What's going on, guys? It's Vaughan here from Body Elements, and today we're going to go through how to fix duck feet. Duck feet, or out-toeing, refer to the lower body deformity where your feet are turned out rather than facing forward, giving the impression of a waddle when people walk, hence the name duck feet. There are various degrees of duck feet, but if your feet are turned out further than about 10 degrees when you walk, you may be putting yourself at a high risk of injury with each step you take. To explain how duck-footedness can form, we only have to look to children. Toddlers in the first few years of their lives, once they learn to walk, will walk around with duck feet because the arches of their feet have not yet developed. The more toddlers walk around barefoot, the stronger the arches of the feet become, and you'll notice the more straightforward their feet will get as they get older. As you can probably guess, the reason older people adopt a more duck-footed stance is because the arch of their feet can get weak if they are constantly wearing heavily cushioned, narrow and heel-raised shoes, or always wearing orthotic inserts in their shoes. The shoes and the orthotics absorb all the impact when you're walking, meaning the arch has no work left to do and slowly atrophies, becomes weaker over time, ultimately resulting in an out-toeing or duck feet. Moving around with your feet in an extremely outward position can increase your risk of injuries like ACL tears, shin splints, chronic hip pain and chronic low back pain. Before we go any further, we must also take into account that some people have a hip anatomy where they'll have a very deep hip socket, and no matter how much mobility work or corrective work you do, their feet may never become truly straight. I still believe the amount those people turn their feet out when they move can be reduced and become a more narrow foot stance. Let's go through a few things that will fix our wayward feet and restore our natural gait. Following on from what we said in the intro, the first thing we're going to need to consider is getting out of heavily cushioned, narrow, heel-raised shoes. The reason heel raises affect our feet is because our foot strikes the ground too early, meaning the foot needs to compensate by turning out to create a stable base. If your shoes are too heavily cushioned, as we mentioned earlier, the arch of the foot is not going to be doing any work and it's going to get weaker and we're going to lose control over it over time. And lastly, if the shoe is too narrow, the crucial big toe won't be able to assist in arch control and the surface area of the foot will be reduced, meaning the foot's going to turn out to compensate for the lack of stability. Please check out my previous video on barefoot transitioning if you want more information on going barefoot and how to go barefoot. The next thing we're going to do is try and loosen up the tensor fascia latae, or TFL muscle. This muscle stretches from the bony part of your hip down to the bony part of your femur and is roughly 2 inches wide. If you push down really hard on these muscles, you might even notice these muscles are quite tender. This exercise we're going to go through will relieve that tenderness and help with getting your feet more straight as you move around. Coined by Dr. Kelly's Tourette as a side hip smash, we're going to use a trigger point ball to attack these TFL muscles. The smaller and more rigid the ball is, the more effective but more painful this exercise is going to be. Start by lying on your side and having the ball underneath the TFL muscle while keeping your target leg stretched out. You can raise your torso with your elbow to lessen the intensity, while also flexing and extending the target leg to play around with different activation points. Get used to where the muscle is and which bits feel tender. Roll around and stop on tight spots for a total of 2 minutes on each side. You'll have to keep doing this at least once or twice a day until the muscle no longer feels tender with the ball underneath it. This will be at least a week of twice a day or 2 weeks of once a day. Pay attention to how your feet start to turn in when you walk around after doing this exercise for a week or two. People with duck feet generally present an incredible amount of external hip rotation while presenting a poor amount of internal hip rotation. To test your internal and external rotation, it's as easy as sitting on a stable surface and rotating your legs. It may help to film yourself here to see where your mobility levels are at. Take your left leg and move it out of the way, then take your right leg, raise it off the ground and turn your foot in towards your body at the knee. Observe the angle it's at. This is your degree of external rotation. Now take that same leg and rotate it away from the body. This is your degree of internal rotation. If your internal rotation is far worse than your external rotation, then it may be a contributing factor to your duck feet. The exercises we're going to do to improve this is a combination of 2 different exercises. They can be done with a band or without a band. The band will improve the mobility faster while also preventing any hip impingements. The 2 exercises we're going to combine are called the lateral hip joint mobilization and the quadruple joint mobilization. If you're using a band, you want to wrap the band around your thigh as close to the hip as possible. You want to attach the band to a structure at a level point to where it's wrapped around your hip, and then you want to come away from the band to a position where it feels like there is a heap of pressure on your hip. For the lateral hip mobilization, you want to start in a kneeling lunge with the banded leg out in front. You're going to push your knee towards the ground with your core engaged and torso fairly straightforward. You should feel the fibers of your outer hip stretching. Pull your knee back to neutral and go for a total of 5 reps. Once you've done 5, we'll move into the quadruple joint mobilization. Keeping the band where it is, we're going to assume a quadruple position with our hips flexed at about 90 degrees. Then you're going to rock the hips away from the band. Now with the hips furthest away from the band as possible, you're going to rock the hips forward and back. Return to neutral and repeat for a total of 5 reps. We'll repeat this on both sides for 3 sets. Check your internal rotation as we did earlier after the 3 sets and see if it has improved. By changing your footwear and utilising these 2 exercises, you should see an improvement in your foot position when you walk, run and even squat. Remember, poor shoes are going to influence poor foot positions, and sitting in chairs all day is going to limit your internal hip rotation. Lifestyle changes influence permanent changes. Thanks for watching. Please like and subscribe if you enjoyed the video and you want to see some future content. Other than that, I'll catch you guys next time.